ensuring that people understand what social distancing means within the context of a healthcare facility. It means that although people are coming to the facility, we're doing a couple of things. We're reducing the numbers of people who are coming into the facility. So we've been slowing down our outpatient clinics. We've been discharging because people who are in hospital are vulnerable. So we've been doing discharges of people who are able to be comfortably discharged so that we can protect those who are most sick and need to absolutely be in the hospital. And in the area of pharmacy, we began the process of doing two things: writing prescriptions so that people can have about 2-3 months stock of pharmaceuticals, so that if we go on a national shutdown or any of those things that will occur when we enter in phase 3, that patients have their medication. So all of these things are happening. COVID is causing us to move very, very quickly. What we recognize at the hospital, although we have a careful process of planning phase 0, 1, 2, and 3, we have a situation where, because of the size and scale of our operations, we had to move earlier than the national planning process to ensure that we were able to slow down our operations, to ensure those who needed care at the hospital were still able to receive it, and that our staff who are delivering care were not placed at risk. What you saw yesterday was what we consider to be genuine fears and anxiety of people who were coming to receive medicines at the hospital, but were being introduced to the social distancing policy. And you can see many of the very people who were extremely vulnerable were clustered, attempting to get into the facility at the time we were trying to space people out. So what you have in front of you is the pharmacy is doing 3 things in order to get medicines to persons. Persons who absolutely must come here, they're bringing in, and I'll take you inside, you'll see people seated an appropriate distance apart. So it means we can only bring a limited number of people into the facility. And if you can see across the road, what we've done is set up tents. We started with 1 yesterday, we've increased another 1 and chairs, so that those people who are waiting can wait, and the security are keeping them at the appropriate distances from each other. We're going a step further. We're in discussions now with an entity called Hopscotch, and others can come forward who normally do the delivery of foods. With the closing down of what is happening in the tourism sector, this entity is available so we can do national, countrywide distribution or delivery of medications. So you've gotten your medication. We also have a call center that has been established. Because we're a hospital, we need to continue to work and function. So if something is happening, we have a call center, or a help center, a help desk manned by doctors, nurses, and paramedicals. So that if people are at home and they have questions about their appointments, they have questions about how they're feeling, they're able to call in and be given the requisite information as to what to do. The key plan is not to stop people from coming to the hospital, to help people know that the hospital is open for business, but we want, as far as possible, those who do not need to come to the institution not to come to the institution, and that is why the help desk is going to help people navigate this very important context that we're in. How the disease is transmitted is mainly through particulates. So we're changing the way we do business completely here at the hospital. We're doing Zoom meetings. I'm with you here because this is of the public interest, and it's important for us to be comfortable in the country, that I've always seen you guys as our stakeholders so you can explain. So we're trying to ask people. So that is what the seating over here is all about. It's a situation where we're asking people as they're presenting to stay at particular intervals. So I'm going to come and show so we can demonstrate it. Stay there. And patients are being asked to sit a certain amount of distance apart. So this is an idea of what would happen patients coming to the hospital. And we will do so by delivering prescriptions to person, having persons, some patients receive specially authorized drugs, or they receive narcotics, so we do have to have counseling, having that done on an appointment basis. So as the epidemic is unfolding, I was so glad, I'm very heartened to see the efforts of the pharmacy department and cooperation of the public. As you can see, this is, you can't contrive something like this, that the public are cooperating with us as we seek to implement social distancing. The hospital is an intimately linked organism where we are as strong as our weakest link. And I'm really very, very proud of the responses that we've gotten here at the hospital. This pharmacy department, they are on the front line. So we are ensuring that they are, the issue of personal protective equipment is so critically important. So we know we have enough, we have in stock, we've projected, we've done modeling, and we've projected the stocks needed for over the next 3 months. But it's important to understand that that stock will last as long as people use the correct procedures. So if fear causes you to double glove or triple glove, it means stock that should last for 3 months will only last for 1 month. If fear causes you to take the supply of N95 masks and you're not leaving it for people, so fear and anxiety is something that we have to really support. The Department of Psychiatry at the hospital is going to be working with teams of employees across the hospital, Dr. Tanya Holder, Dr. Catwell, and others, to make sure staff and staff mental health and patient mental health are adequately addressed, because the anxiety is very real. So we do have enough supplies if people are using them carefully, if they're not hoarding, if they're not engaging in malpractices. And thankfully, with the strong support of the Prime Minister and others in the private sector, we're bringing more and more supplies into Barbados as China and the supply chains in those areas begin to open back up.